The gold standard in breast augmentation or enhancement is using silicone implants. What I have in front of me are various implants. You can see that this is a round shaped implant, and you have this which is an anatomical implant. We'll talk about these, and you have various texturing of surfaces of these implants, which we shall talk about these a little later. What we have in the at the moment is the 8th generation of implants, which means that all these gels, all these implants are filled with a cohesive gel, which means that when you actually cut an implant, the gel doesn't leak or bleed. It remains like a solid block, and it remains in the body. Unlike the previous implants, the earlier generation implants, there were a lot of silicone leaks, and there used to be a lot of bleeds, which created a lot of problems for the patient. But the present generation of implants, these are very advanced, and you have a lot of these implants which have a cohesive gel of silicone within them. Now, let's talk about the shapes. The most commonly used implant is a round implant. So this has a specific diameter, and for a given patient, the base of the breast, the implants are chosen and they are inserted. So you have the round implants like this, which are most commonly used. And besides this is the teardrop or the anatomical implant. If you see, this particular implant is actually mimicking the shape of the breast. So these are tapered to the top and they are round at the bottom. So this is what is an anatomical implant, and this is how it looks like. And there are specific conditions where we use these anatomical implants. And then you have this implant. It's got a micro texturing. Now, if you compare the two implants, this is smooth. There's no texturing at all, and this implant has more texturing. And if you see this, this is micro texture. So previously, what was believed and what was thought was that the texturing, it reduces the body's tissue reaction and thereby causes the capsule to be thinner and causing no capsular contraction. So that was the purpose of using the textured surfaces. But later research showed that the texturing can also cause some amount of problems like rare breast cancers arising from the capsule. So then what happened was the implant company started reducing the texture, which is coarse texture like this, and then it became very fine texture. And of course, these days we're using no texturing implant. It's the smooth implants like this. There's no texturing at all, for the simple reason that the chances of developing the anaplastic lymphoma, which arises from the capsule, is very, very less with the smooth implants. So you have all the varieties, and we can actually help the patient choose which implant is ideal for them based on their requirements, based on their measurements, and based on our clinical experience.